next up, we've got Sofia May. Her individual speech is on the topic of issues that a lack of diversity in healthcare can cause. Yet another really, really powerful speech that I know you've had so many so far, and you're going to be having quite a few the rest of the day. But I'm going to invite Sofia onto stage. She's going to be wonderful.
I'd like you all for a moment to just close your eyes. Imagine a world where you live in a community where you're not represented, where the services that are designed to help you don't know how to help you. Open your eyes. This is the world that we live in right now. These are the experiences that so many people of ethnic minorities face day in, day out. Too many. Most of us, every day in our lives, will look at a mirror. The face looking back at us is a familiar one that we remember and recognise. We might notice every little thing on our skin and part of us, but not everybody else does. Black women are most likely to die during childbirth. There are 40 deaths per 100,000. For white women, there are only 13.7 per 100,000. Only 18% of the medical illustrations that we use to teach trainee doctors will depict ethnicities other than whites. Take a minute to let all those statistics sink in. But these people, they are more than just numbers, statistics. They have lives, and the healthcare service is a system that's implemented to support those lives. So why isn't there the support and representation that healthcare desperately needs? It is crucial that prejudices are eliminated and reprogrammed from the start of medical careers, or else the future consequences can be incredibly severe. The University of Bristol Medical School insists that immediate action is taken to investigate why teaching will primarily focus on how illnesses present themselves in white people. This comes after students claim they were unprepared to treat patients from ethnic minorities because of a lack of training in their education. Students are often taught to look for a constellation of signs, such as a blue tint to the lips or fingertips, which would help them determine how ill someone is when they are short of breath. However, these signs can look varyingly different on darker complexions. According to Dr. Hartland, who is a lecturer helping to lead these changes, we are teaching students to recognise a clinical sign primarily in white people, whilst not acknowledging the dangers these differences have. Of course, all of this has brought about implicit or unconscious biases. We attach emotions, and this changes how we view people. These then turn into stereotypes that we attach to certain racial or ethnic groups. Neuroscientists who study this extensively have believed that this is part of evolution. We live in a world where we have to take in so much information every day. So if we can categorize these things, it's easier for us. Some people will use this to justify their bigotry, but this is simply not true. We as humans have the ability to counteract and dispute stereotypes that we know to be untrue, that you know to be untrue. A lot of people are pushed away from joining the healthcare services because they have had bad experiences. This happens to too many people. The treatment between ethnic minorities and white people is incredibly separated because of all these biases. Too many medical doctors and students believe that people of a darker complexion have a higher pain tolerance. This leads to either not being given good enough pain medication or not being taken seriously. It is so important that doctors know how to actively combat these things in their profession. How can we change the healthcare system unless we break down the barriers that we've put up? Dr. Jagadish Nanjappa is a respiratory physician, and during his work in the UK in 2012, he was frequently denigrated by his supervisor. He told us that in front of everybody, in front of the patients, in front of the nurse, he was shouted at for asking a question at their first clinic together. When he spoke to the supervisor's line manager, he was told these words: "It's a small country. You know that you will not get a job as a consultant in this country," would be the response. This is absolutely appalling. Nobody deserves to have to go through that or hear those words spoken to them. Too many people go through this all the time, and it goes unnoticed. Many try and report it and get told the same things that Dr. Nanjappa was told, that they will not be able to get a job if they speak up about it. So many stay silent. But really, we need to talk about it. We need to speak up because this happens too often. The services that we have today are supposed to be diverse and they are supposed to help everybody. But because so many people are mistreated in the healthcare services, they don't work in these sectors. If we had a more diversified workforce, we would be able to not only give everybody the treatment they deserve, but also improve the education that they get so that they can carry on in their professions doing a good job. So how can you make the change that we so desperately need? And the truth is, the little things make all the difference. Challenge what you see, be the change that you want to see. As Maya Angelou, a civil rights activist, said with pride, if you don't like something, change it. If you can't change it, change your attitude. Make that first step towards a change for the better. In the Southwest, the Diversity, Equity and Inclusion team has been working hard to make sure that people from diverse communities are able to work in inclusive environments and have the same career opportunities as everybody else. Part of their work ensured that 50,000 people from diverse communities were able to get their COVID vaccinations. This is only one example. You can follow in the footsteps of them. You can make that change in your community, may it be where you live or in St. John's Ambulance. You can do this yourself. Be educated. Knowing what's wrong will solve half of the problems that we have. You have the ability to make that change. You have the ability to start something new. So I ask you today that you put yourself in someone else's shoes. I ask you today that you strive for a change in the way our medical systems work. I ask you today to reflect.
And that was Sofia. I hope you all enjoyed that speech. Next,